So thank you so much for joining today. We are delighted to have this one-on-one conversation with you on the topic around art of aligning CX strategy and brand positioning. But before we start on to the same, can you please take us through your journey in, I would request quick few minutes, but yes.
So my journey have been very intensely into the retail arena for India and across multiple countries of the world. I have been into retail for more than 2 decades now, but primarily I have operated into the healthcare segment of retail. That's in short about my journey. Well, I'm associated with multiple business management universities and colleges of India and out of India, where um, I am a guest lecturer and faculty there, and that's what I'm all about.
Great. Thank you so much. So, sir, how is the market right now? So, with Dava India primarily focusing on to generic medicines, can you please talk about that and the market that you're facing right now? Just to give a brief overview to our audience who is, not from the space.
So I belong from healthcare industry, and healthcare at large is one of the most critical markets for any country as you know when the country really wants to evolve. Now, when I slice it up, I am from a section of affordable healthcare where we have been working extremely hard on affordability of healthcare. The market at large needs very high quality, good medicines at affordable prices, and that's what we have been working out both in urban and rural to ensure that the reach towards affordable healthcare gets into much faster for the Indian environment.
Thank you so much. So, while with your mission to provide good quality medicines at affordable prices at all locations, what kind of challenges have you faced? And if you can share some, and also what kind of challenges, particularly about skepticism around generic medicines, especially keeping in mind that most people go after branded medications and they have a greater leverage over the ecosystem.
A strong challenge that India still faces is that usually the physicians or the clinicians, most of them in India, they still write brands. Now, that's a huge challenge because for a normal consumer or a patient, they really don't understand much about the technicalities of it. And for them, what happens is that they feel that if a doctor have written a specific brand, that is, what they should go and take. But if you see across the most advanced countries in the world, they mostly operate at close to around 82% generics. Now, this transition will take time. It's like, there was a time, when many of you here used to go to the tailor and collect the cash. You used to take a small token from the bank and used to stand in the tailor and through a small hole used to collect the cash. But the ATM machine evolved, and now the UPIs have evolved, and now more evolutions are happening. So these evolutions takes time, and especially in healthcare, people are very very apprehensive to change. Of course, under the leadership of our honorable Prime Minister, there's a lot of work which is going on in the country, but that's more from the government section. In terms of private, we are the only largest private generic retail chain across the country, having more than 1,000 stores across, where we are working to ensure that we educate the end consumers and patients. We do a lot of work in the villages. We do a lot of activities with the gram panchayats, with the communities there, so that they understand that it's time that they need to get themselves more educated. But this transition will definitely take time, and but that's what someone have to do it to make the country much more better than where it is at this point of time.
Thank you so much, sir. So it's not just in generic medicine space that we face challenges around balancing customer loyalty and without compromising on product quality. I'm sure the audience that is over here belong to different industries and they also feel the same, experience the same kind of challenges in balancing both cost and quality. So, in a country that is mainly driven by affordability, how can companies, not just in generic medicines but wider as well, maintain customer loyalty without compromising on product quality and margins? What would be your advice?
I feel for all our colleagues out here and fellow beings who may not be in healthcare but maybe in other industry, the the critical parameter to ensure that you run the operations of the organization well, because I have been into very large organizations in my career, is that you have to ensure that you generate true value to the end consumers, whoever it is, whoever is your consumer. Now, when you generate value, you have to ensure that you reduce the wastage that actually builds up the fat in the cost. Now, that's extremely important, and that's what we do as an organization. And every organization that I have been earlier, also, I have done that. I try to understand that what are the potential wastages where your cost is actually building up, which actually hits on to your EBITDAs and IRRs. So once you start understanding that without compromising the true essence of your product, then you actually build an organization that would not only be sustainable in terms of profitability numbers, but that would actually emancipate onto a larger value to the end consumers. And that mix and that balancing is what is extremely important for one to navigate when you actually run a large corporation.
Thank you so much, sir. So, definitely, your suggestions is applicable to the wider industries as well. Another aspect is brand differentiation in the competitive market. So, what would be your suggestions to our audience over here who would want their products to stand out, but at the same time, what strategies and attributes they should keep in mind? Also, if you can share examples of what you do at your organization.
Sure, I'll take the first question first, and then I'll come back to what we do. So when you talk about brand differentiation, now for many people, the understanding of branding is very superficial. That's what I have seen. I feel that it's extremely important to understand uh, depth of brand salience and brand equity. Now, when you talk about brand salience and brand equity, typically what happens is that you have to understand that what is it that your brand is all about. Now, as promoters or as corporate leaders, we need to make this thing extremely clear for the end consumer to perceive. In fact, we have one of the former Indian cricket captain as one of our brand ambassadors, who works with us very closely. In fact, we also have the toughest white man in the world who have defeated Mike Tyson as one of our international brand ambassadors. So you need to understand that how will you actually connect this with the product that goes to the end consumer. Now, this connect is the most important thing. Unfortunately, I find that organizations lose the vitality of the connect when they start chasing the financial numbers. Then what happens is everything starts getting diluted and you build a brand or a company for only some 30, 40 years. But if you really want to build a company for 300, 400 years, then you need to understand the depth of the touch point of the consumer towards the true value. How we do it at our organization, or how I have done it multiple times in my previous organizations. If you do a little bit of check back about me, what I have done from internet, you can find a lot of data about me as well. Is that what we try to do is that we try to understand what is the consumer needs and how can I offer that high quality medicine without compromising the quality. That's extremely important. If a consumer takes in that diabetic medicine, or if the consumer takes in that specific hair serum, or if the consumer takes in that malt drink, or if the consumer takes in that vitamin B12, the consumer get well in the same time what he anticipates and expects of the same equivalent of a brand. Now, there is, where we have to work. How do we still reduce the cost by 70% or 60% or 65%, but still give the same value to the end consumer? So when you come to branding, since this question was related to branding, Maybe I could have done a much fancy story around it, but which I don't do. Or maybe, I could have done a great packaging, but maybe I could not afford. Because for me, it's more important that the consumer need to take that medicine and his blood pressure levels need to be at a rational level. So I have to choose that do I want a fancy story or do I need to give a great quality so that consumers is pocket friendly and he gets the highest amount of quality. So there is the salience between a brand management story that you want to build. Brand management is not about the glorified versions that sometimes corporate things. It's about what is the value you actually identify and add on to the end consumer.
Thank you so much, sir. So, amazing, suggestions shared by you. Another aspect that we saw in our multiple sessions earlier, as well as the earmark presentation, was personalization. So, when the products are personalized, services are personalized, they touch the audience, more. Another aspect is integrating social initiatives with brand strategy, which Dava India has been actively doing, which is aligning itself with social causes such as women's health, environmental consciousness, etc. So, how do these initiatives align with your broader brand positioning, and what kind of impact do they create on customer perceptions?
Sure. I'll take your second question very strongly because that's one thing that I myself get in extremely in depth. What we do is that, see, on one hand, when we run company, you have to run your numbers, you have to ensure that your turnovers are met, your budgets are delivered, your EBITDAs are healthy, and you build a great organization. But that's not all about. That's only one part of running an organization. The actual essence of running an organization is what you're actually contributing back to the land that you work for. So in terms of social initiatives, I am absolutely against those companies who say that this is what we do for CSR. No. Trust and ask your own conscience what you actually do. That is what we do. We go to villages, we work with women, we work where we find domestic violences happening. There is, where we work in. We work with women across the country in the villages where we see that there is a huge issue on menstrual hygiene. Trust me, in the villages, women cannot afford sanitary napkins. And they don't even understand sometimes. So thereby they use clothes and that brings on huge UTI infection, urinary tract infections. So we are working with them to actually eradicate those things from India. We are it's forget about, of course, we do a lot of free distribution of sanitary napkins, etc., but that's not what we discuss. That's the reason we never glorify those things ever. But when you go and work in their houses and make those women understand that, look, this is the problem that you'll have if you use clothes, if it becomes wet, this is the UTI that you have. Then the outcome of UTI could be your fever. Outcome of UTI could be irritation during urination, etc. And how you educate them will actually build a next generation of a healthy girl being brought up into a mother. Now that is what the social impact that we are trying to build across the country. We do a lot of work also for touching lives. Anyone who have seen any of our own company stores across the country, in fact, media have heavily covered this. They have seen that during summer, we ensure that we have fresh water bowls outside the stores. Even if the stores are not looking nice, I don't care. We have to do what we believe in doing. Now during the monsoon, in front of our stores, we have made a small hut and house where the dogs and cats can come and rest inside. Our branding agencies told us that it's the stores will look shabby. I said, so be it. Even if the stores are looking shabby, just because we are doing that, but if that adds on to the life of someone else, then you actually walk the talk. A good CEO is not who comes and says that this is what needs to be done. When you enact it and change the society, then we all build a better society. When we have women coming into us and saying that okay, they have been benefited because our team had gone and arrested the domestic violence, that is what you are changing. So this is way beyond your top line numbers. This is way beyond your budgets, and that is the reason whenever I meet large corporations or investors, I say that it is our moral responsibility for all of us to change the country, and only then we can aspire to be actually a much advanced nation from where we are at this point of time.
Thank you so much, sir. And that beautifully morphs into our next question, which is values and ethics, and the role of values and ethics and morals in shaping up the CX strategy, customer experiences, brand positioning overall for an organization. So you shared, amazing examples of what Dava India is doing, but what kind of importance do these values and ethics will play? So if you can just iterate.
Values, ethics, and culture are the three pillars for us. Not because I'm sitting and saying out here, please check back with any of our employees across the country, because that's a fundamentals. Most retail companies always operate to see that how they can actually increase the ticket value. We don't. We there's a clear mandate to the pharmacists at the stores or at any network level that we operate, that don't run after the numbers. If you are genuinely right, in short term you may not have your numbers, but you will have your numbers eventually. So we don't try to oversell. The retail is typically how much more extra additional sales that you can do so that your ticket value increases. Trust in me. That's a very, very short term story that people try to build. That's a story of maybe 5, 10, 15, 20 years. But if you try to inculcate till the last mile of your employees, the security guards, the last mile of your store guys, that look, when a consumer comes in, be compassionate, have that ethos and values, ensure that you do not oversell to that customer just to increase the day in revenue, then you build a different organization altogether. Then the organization is not driven only by the financial numbers at the month in what you have to see. Then you also start touching lives. And this is a very, very strong mandate, both at a corporate office, head office, at our other branches, and at the retail store level. And it percolates consistently and seamlessly. And that is the reason I ensure that all the trainers, the L&Ds who operate, they continuously embark on the values and beliefs. And this is a continuous process for the team. And not only that, I myself, through the help of online platforms and physical, I myself do training to the last mile of the organization to ensure that they do understand the value system. Because values is always top down. It is exactly how you say and how you believe is what it trickles down to the last mile. And that is what is important for every organization.
Definitely, sir. Thank you so much. We now come down to our last two questions for the discussion, although we would want it to go on and on, but constraints. So, with the advent of latest emerging technologies, as we have been seeing, which are impacting the entire customer experience journey, making things faster, smoother, quicker, how has the adoption of such technologies in your organization supported the ongoing work that you have been doing, and what kind of more innovations would you want people to be developing to ease the process even further?
Well, the actual data, blockchain, and AI, along with block data, is doing a lot of work, and globally we find a lot of work happening. But if you ask me personally, I will play an oxymoron in this whole story. It is not that technology is really helping uh, the larger mass of the country. We are borrowing a lot of things from the advanced countries. Ask yourself, are we really ready for that? 75 to 80% of our people don't even understand what these things are. They don't even have any clue of this. People who don't work in the villages, they don't understand these things. And even in the city, whatever these technologies, these artificial intelligence, these blockchains that we are speaking is for a very, very minimal section of people. What India needs now is not this. What India needs now is a proper education. What India needs now is a proper safety of women. What India needs now is proper health care. Unfortunately, we are jumping the guns. And I have been talking this in the biggest of IT forums. That first, let's take a step back and think that are we in the right track? When we don't have proper healthcare systems, we are going for things which have very big jargons. Yes, we are borrowing from abroad, but they have already done all these things earlier, and then now they are doing it. But for us, we feel no, everyone else is doing, why not we? But first is the basic safety for women, which is required, which we are working out. First is everyone should have affordable healthcare. These basics. If you may not understand because you have enough access to buy medicines, but someone who do not have access to buy medicines, they understand that what affordable healthcare means. They just go to the hospital, afford angioplasty or angiography. They can't afford a TKR or a THR, a total knee replacement or total hip replacement. What means, and we are talking about all these things of AIs. For what percentage of people? I want all of you to think. It's a great story. I can talk 15 minutes, half an hour on AI, but I think that's not relevant. What is relevant is that we need to have a patient who walks into the hospital and we will say, okay, your stent cost, a good quality stent cost, maybe within 5,000 rupees, and a complete angioplasty could be done within 25,000 rupees. That's what we want. We would want that, okay, our entire education system need to change. And in my earlier speech, whoever was there must have heard, that's exactly what I told. We are working out with the teams that can we build self-defense in the Indian education system from the onset for the women. That's what is required. So what is not required, hence I told that I would not be very comfortable on this question, is that I can always, say, because, I know this is a forum for these things, but what do I gain out of it? I don't gain, neither you gain anything out of it. But you, me, and the country would gain if you really understand what I'm trying to embark. And that would be the change for India. And that is what we need now.
Thank you so much. So basically stepping back and reprioritizing the absolute priorities for any organization, any industry that you may belong to our non-medical audience, that would be basically controlling the diabetes first before we jump on to advanced technologies for detecting the gender of the baby. So yes, the last question for this discussion would be your advice to budding entrepreneurs on how to align CX strategy and brand positioning cohesively.
For any budding entrepreneurs, for any senior leaders out here, of course, it's your choice, but my suggestion is that whatever you do, add genuine value to the outcome of it. Unfortunately, small, mid, and large organizations operates only on financial numbers, but that's too pseudo. If you do something that would add genuine value to the end consumer and do good to the society, then that builds a better country for us. I'm extremely passionate about building a better India, and every time I have worked on that. That's the reason whenever I have started working out of India, I always tend to come back to India. So if any budding entrepreneur or any corporate leader who is here, if they see that what is the value that they can actually build towards their society, that would not only enrich them, but that would build a better India for all of us.
Thank you so much, sir. It was a pleasure having you for this discussion.